Dark neck, skin tags, belly fat, your body's secret diabetes warnings. Are you concerned about your health but feeling lost in a sea of information? It can be overwhelming trying to decipher every little ache and pain. Today, we're diving into a topic that's incredibly important for your well-being. Type 2 diabetes. While the thought of this condition might seem daunting, understanding the early warning signs can make a world of difference. You might be surprised to learn that your body often sends subtle signals long before a diagnosis. These signs aren't always obvious, and they're easy to overlook or dismiss as insignificant. But trust me, paying attention to these whispers from your body is crucial. Early detection and lifestyle changes can significantly impact your health journey. In this video, we're going to unravel 3 often overlooked signs of type 2 diabetes: dark patches on your neck, skin tags, and belly fat. We'll delve into the science behind these connections, explaining why these seemingly unrelated symptoms can be early indicators of this serious condition. So, if you're ready to take charge of your health and learn how to spot these hidden clues, stick around. We're about to equip you with the knowledge you need to understand your body better and take proactive steps towards a healthier future. Have you ever noticed a darkening of the skin on your neck? Perhaps it appears velvety or feels thicker than the surrounding skin. This common condition is called acanthosis nigricans, and while it can be harmless, it can also be a red flag for insulin resistance, a precursor to type 2 diabetes. Insulin, a hormone produced by your pancreas, is responsible for regulating blood sugar levels. When your body becomes resistant to insulin, glucose can't enter your cells effectively, leading to elevated blood sugar. This resistance can manifest externally as acanthosis nigricans. But why the neck, you ask? Well, the exact mechanism isn't fully understood, but researchers believe that excess insulin might stimulate the overproduction of skin cells, leading to the darkening and thickening of the skin, particularly in areas with folds like the neck, armpits, and groin. While acanthosis nigricans itself isn't harmful, it's a visual cue that something might be amiss with your body's blood sugar regulation. Recognizing this early sign and taking action is key to preventing or managing type 2 diabetes effectively. To truly grasp the significance of a dark neck as a potential warning sign, we need to delve deeper into the concept of insulin resistance. Think of insulin as a key that unlocks the doors of your cells, allowing glucose from the bloodstream to enter and provide energy. When you develop insulin resistance, it's like the locks on your cells have become rusty. Insulin struggles to open these locks, making it difficult for glucose to enter. As a result, your pancreas goes into overdrive, pumping out more and more insulin to compensate, but eventually, this overproduction can take a toll. Over time, the pancreas may not be able to keep up with the demand for insulin, leading to persistently high blood sugar levels, a hallmark of type 2 diabetes. This condition can have serious consequences for your health, increasing the risk of heart disease, stroke, nerve damage, and vision problems. Recognizing the early signs of insulin resistance, such as acanthosis nigricans, allows you to take proactive steps to improve your insulin sensitivity and prevent these complications from developing. Now that you understand the connection between a dark neck, insulin resistance, and type 2 diabetes, you might be wondering what you can do about it. The good news is that lifestyle modifications can make a significant difference in managing both the appearance of acanthosis nigricans and your overall metabolic health. One of the most effective ways to improve insulin sensitivity is through diet and exercise. Focus on incorporating whole, unprocessed foods into your diet, such as fruits, vegetables, lean proteins, and whole grains. Regular physical activity, even moderate-intensity exercise like brisk walking, can enhance your body's ability to use insulin effectively. If you're overweight or obese, losing even a small amount of weight can have a profound impact on your insulin sensitivity. Aim for a gradual, sustainable weight loss of 1 to 2 pounds per week through a combination of diet and exercise. Remember, managing acanthosis nigricans and insulin resistance is a journey, not a sprint. Be patient with yourself. Celebrate small victories, and consult with your healthcare provider to develop a personalized plan that meets your individual needs. While lifestyle changes are crucial, it's essential to remember that self-treating based on internet research is never a substitute for professional medical advice. If you notice darkening of your skin or have concerns about insulin resistance or type 2 diabetes, reach out to your doctor. Your doctor can perform a simple blood test to assess your blood sugar levels and determine if you have insulin resistance or prediabetes. Early detection is key to preventing the progression to type 2 diabetes and managing your health effectively. Remember, you are your own best advocate for your health. Don't hesitate to ask questions, seek clarification, and work collaboratively with your healthcare provider to make informed decisions about your well-being. Your proactive approach can make a world of difference in your long-term health outcomes. Skin tags, those small, flesh-colored growths that often appear on the neck, armpits, and groin, might seem like a harmless annoyance. While they're generally benign, their presence, especially in larger numbers, can sometimes be linked to an increased risk of insulin resistance and type 2 diabetes. These tiny, painless bumps occur when extra layers of skin cells grow, forming a stalk-like projection. While the exact cause of skin tags isn't fully understood, research suggests that high levels of insulin in the bloodstream might play a role in their development. Insulin, as we discussed earlier, is responsible for regulating blood sugar levels. When your body becomes resistant to insulin's effects, insulin levels can rise in an attempt to compensate. This excess insulin is believed to stimulate the growth of skin cells, potentially leading to the formation of skin tags. While the presence of a few skin tags doesn't necessarily mean you have insulin resistance or type 2 diabetes, it's essential to be aware of this potential connection and consider other factors, such as family history and lifestyle habits, when assessing your overall risk. The link between skin tags and insulin resistance has been a topic of interest for researchers for several years. Studies have shown a correlation between the presence of multiple skin tags and an increased risk of metabolic disorders, including insulin resistance, prediabetes, and type 2 diabetes. One study published in the journal Diabetes Care found that individuals with multiple skin tags were more likely to have insulin resistance, even if their weight and body mass index, or BMI, were within a healthy range. This finding suggests that skin tags might serve as an early warning sign of underlying metabolic disturbances. Another study published in the Journal of the American Academy of Dermatology found that people with skin tags were more likely to have elevated levels of insulin in their bloodstream, further supporting the connection between these two conditions. While more research is needed to fully understand the complex relationship between skin tags and insulin resistance, the existing evidence highlights the importance of paying attention to these seemingly insignificant growths and considering their potential implications for metabolic health. If you're concerned about skin tags, rest assured that several safe and effective removal options are available. However, it's crucial to consult with a dermatologist or qualified healthcare professional to determine the best course of action based on the size, location, and number of skin tags you have. One common removal method is cryotherapy, which involves freezing the skin tag with liquid nitrogen, causing it to fall off within a few days. Another option is electrocautery, where a small electric current is used to burn off the skin tag. For smaller skin tags, surgical removal with a scalpel or scissors might be recommended. This procedure is typically performed under local anesthesia and leaves minimal scarring. In some cases, your dermatologist might suggest tying off the base of the skin tag with a surgical thread to cut off its blood supply, causing it to shrink and fall off. Remember, attempting to remove skin tags yourself at home is not recommended. Improper removal techniques can lead to bleeding, infection, and scarring. It's always best to seek professional help for safe and effective skin tag removal. While skin tag removal can address the cosmetic aspect, it's essential to remember that they might be a sign of underlying insulin resistance. Therefore, it's crucial to address the root cause by adopting a holistic approach to improve your metabolic health. Lifestyle modifications play a pivotal role in managing insulin resistance and reducing your risk of developing type 2 diabetes. Focus on incorporating regular physical activity into your routine, aiming for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Incorporate a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, while limiting processed foods, sugary drinks, and unhealthy fats. These dietary changes can help regulate blood sugar levels and improve insulin sensitivity. Remember, taking control of your health is an ongoing journey. By making conscious choices to prioritize your well-being, you can lower your risk of developing insulin resistance, type 2 diabetes, and other related health concerns. Let's talk about belly fat and diabetes. Understanding this is crucial for diabetes prevention. Visceral fat surrounds vital organs like the liver and pancreas. It's metabolically active, affecting insulin sensitivity. This leads to insulin resistance, a red flag for type 2 diabetes. Addressing belly fat can reduce your diabetes risk. In the next sections, we'll discuss practical steps to improve your health. Let's talk about how to tackle belly fat head-on. The first line of defense is your diet. Make sustainable changes that nourish your body. Cut down on sugary drinks. Rethink refined carbohydrates. Opt for whole grains, fruits, and vegetables. Incorporate protein and fiber for fullness. Make gradual changes and find healthy swaps. Now let's get moving. Exercise is key to shedding belly fat and reducing diabetes risk. You don't need a gym membership to benefit. Any movement is better than none. Incorporate more activity into your daily routine. Take the stairs instead of the elevator. Park farther away from your destination. And find opportunities to move throughout the day. Combine cardio and strength training. Cardio exercises like brisk walking, jogging, swimming, or cycling get your heart rate up, burn calories, and help you lose weight overall. Strength training builds muscle mass, which burns more calories at rest than fat. Incorporate bodyweight exercises like squats, push-ups, and lunges, or use weights if you have access to them. The key is to find activities you enjoy and make them a regular part of your routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week, and remember, consistency is key. Make exercise a non-negotiable part of your schedule, just like brushing your teeth or eating dinner, and you'll be amazed at the difference it can make in your waistline and your overall health. Beyond diet and exercise, lifestyle factors like stress and sleep are crucial for your health. Chronic stress releases cortisol, leading to belly fat and health issues. Incorporate stress-reducing techniques like meditation and yoga. Prioritize sleep to balance hunger hormones and reduce cravings. Aim for 7 to 8 hours of quality sleep each night. Small, sustainable changes can make a big difference in the long run. We've covered a lot of ground in this video, exploring some of the lesser-known warning signs your body might be sending about your risk for type 2 diabetes. From the subtle darkening of your neck to the appearance of skin tags and the accumulation of belly fat, these signs point to insulin resistance. Knowledge is power. By understanding these signs, you can take proactive steps to protect your health. Consult with your healthcare provider if you notice any of these signs. Thank you for joining me. Please like, share, and subscribe for more health content.